Hello everyone, my name is Miranda Echevarria and I am a scientist that specializes in polycystic ovary syndrome research. I am most known for my work with the Center for Reproductive Health and our research on further understanding this disorder. I've come here today with the hopes of further educating you on the seriousness of PCOS and how very common it is amongst women around the world. My sister in particular has suffered from this disorder since she was a teen. She is the main reason why I decided to specialize in it. I've also come to teach signs and symptoms that you or the women in your life can look out for and how exactly you can be diagnosed and treated. To begin, PCOS mainly affects organs within the endocrine system, so it is considered an endocrine disorder. The endocrine system is a collection of glands that are located throughout the human body. Both women and men have endocrine systems with most of the same organs besides the testes, ovaries, and uterus. Male bodies only have testes in their endocrine system and females only have a uterus instead of ovaries in theirs. One of the endocrine system's jobs is to send messages to our organs to help regulate their functions. Metabolic functions, growth and development, sexual and reproductive function, sleep and mood are all regulated consistently by the hormones within the endocrine system. Now some of you may be wondering what exactly is PCOS. Polycystic ovary syndrome, or PCOS, is a hormonal imbalance in females that causes an overproduction of some male hormones. The main male hormone shown to be overproduced is androgen. Now both men and women produce this hormone naturally, but female bodies are only supposed to produce a small amount compared to men. Androgen's main job in a woman is to help start puberty and reproductive functions, which also stimulates growth of hair in regions like the mons pubis and axilla or armpit. When this hormone is overproduced, it creates a range of issues with most organs in the female endocrine system. The statistics of PCOS are where researchers can really see how common PCOS is amongst women in reproductive age. According to a research article written by Tremblay Davis and two other colleagues, around 16 to 18% of women are affected by PCOS worldwide, and it is considered the most common endocrine disorder in women ages 15 to 44. In the US alone, 5 million women are said to be affected by this disorder. Also, as reported by Muhammad Khan and two of his other colleagues, PCOS is the cause of 40% of female infertility cases. Now, because PCOS is a multifactorial disorder, it manifests itself in many different symptoms. The most commonly reported symptoms include difficulty losing weight or excessive weight gain, hair that grows excessively in places like the chin, and overall thinning and balding of hair, also medically referred to as alopecia, and painful hormonal acne. The most notorious symptoms of PCOS, however, are a struggle with irregular periods, which can range anywhere from missing your regular monthly period, having painful menstrual cramps, and also experiencing heavier than normal bleeding during your cycle. Bleeding is considered abnormal or heavy when a pad or tampon needs to be switched out at least every 2 hours instead of the usual 4. Difficulty becoming pregnant has also been reported. To delve deeper into infertility, PCOS is the most common cause of infertility in women. In research conducted by Merville and their colleagues, women with PCOS do not ovulate regularly. Ovulation is when the ovaries release an egg into female fallopian tubes, so a sperm cell can penetrate and begin fertilization. Because PCOS stops the female body from doing this, it can be extremely difficult for a woman with the disorder to become pregnant. Oftentimes, the only way for a woman with PCOS to become pregnant is with the use of medication to aid in the ovulation process. Continuing on with symptoms, clinical manifestations of PCOS also include insulin resistance. Because PCOS patients are often insulin resistant, their chances of developing type 2 diabetes is much higher than the average person. This will be talked about more once I reach the comorbidity slide. Doctors also report seeing heightened blood pressure levels and heightened blood sugar and cholesterol levels when the blood testing is conducted, and of course cyst growth. PCOS must be diagnosed by a healthcare provider. It cannot be self-diagnosed. There isn't a single test to determine the presence of the disorder, but doctors most commonly use a criteria that was developed in 2003 called the Rotterdam Diagnostic Criteria. This criteria states that there must be the presence of at least 2 of 3 symptoms listed, the symptoms being anovulation, hyperandrogenism, and polycystic ovaries. With using the Rotterdam Diagnostic Criteria, the process for diagnosing is also done through extensive testing and discussion with the medical provider and patient. During the diagnostic process, the patient's personal medical history is taken where they will be asked about their menstrual cycle, have their weight and blood pressure checked, and will also be examined for any abnormal hair growth or loss. A transvaginal ultrasound is also conducted to look for the polycystic ovary growth mentioned earlier, though cysts are not always visible. Tremblay-Davis and 2 other colleagues also state in their research that blood testing should always be taken to rule out any other possible causes for the patient's symptoms when diagnosing. Being that polycystic ovary syndrome is so common amongst women, there are a number of things that can put an individual at higher risk for developing PCOS. Number 1 being that there is a documented family history of past diagnosed PCOS or known issues of other women in their family having trouble becoming pregnant. Next, having diabetes and/or insulin resistance also increases a woman's risk of PCOS. Women who are in their reproductive years ranging 15 to 44 and are known to have struggled with obesity and poor exercise and diet habits are also predisposed to this disorder. Now, there are numerous diseases that are seen simultaneously with PCOS amongst patients. These diseases include type 2 diabetes, obstructive sleep apnea, hypertension, cardiovascular disease, high cholesterol, metabolic syndrome, glucose intolerance, depression, and anxiety. Unfortunately, women who have PCOS and depression or anxiety simultaneously are at an increased risk for suicide. It is necessary that patients that are recently diagnosed for PCOS are also screened for comorbidities. Like previously stated in my discussion of symptoms, PCOS is a multifactorial disorder. It is also heterogenetic, which means that it is very complex in the way it presents itself in different women. Some women may have an easily dealt with symptoms, where others have an extreme manifestation of symptoms. It is not clearly inheritable amongst family members, but some statistics do show that 20 to 40% of women who get diagnosed with PCOS also have a mother who has been diagnosed or experienced similar disturbances in their reproductive and metabolic health. It is extremely likely that poor diet and exercise habits learned from their female parent throughout childhood contribute to their diagnosis of PCOS later in life, since poor diet, exercise, and overall obesity increase an individual's chances of developing this disorder. Unfortunately, there is currently no cure for PCOS. As of now, managing symptoms is the best that can be done. Depending on the symptoms felt, there are a variety of ways to treat each symptom. For women struggling with obesity, lifestyle modification can be extremely beneficial. Working with a nutritionist to improve diet and increase your daily physical activity are all great ways to start. For women struggling with hormonal acne, speaking with a dermatologist and sometimes being prescribed an acne medication can help them to better manage breakouts. Following regular waxing and shave routines can also help women struggling with hirsutism, or for a more permanent solution, laser hair treatment on the affected area is an option. When speaking to an individual's healthcare provider, birth control can often be prescribed. The combination birth control, or progesterone, can help a patient regulate their menstrual cycle by managing the flow of blood and intensity of menstrual cramps. It can also help in making menstrual cycles more regular. Lastly, women with PCOS who are struggling to become pregnant because of anovulation are often prescribed letrozole to help their body to ovulate more regularly. In conclusion, PCOS is an endocrine disorder that affects a female's hormones. It causes enlarged ovaries and ovarian cysts. It presents in women of reproductive age, roughly 15 to 44 years old, and it comes with a variety of symptoms to include alopecia, hirsutism, and obesity. It most notably creates issues with a woman's menstrual cycle and fertility. There is no cure currently for PCOS, but it can be well managed by independently treating each symptom with the help of a doctor and dermatologist. Thank you guys so much for listening to my presentation. I hope I was better able to educate you on PCOS.